Today I'm going to explain what are the different types of HIV testing. There are three main types of HIV tests: antibody tests, RNA tests, and a combination test that detects both antibodies and viral protein called P24. All tests are designed to detect HIV-1, which is overwhelmingly the most common type of HIV in the United States. Some antibody tests and the combination test can also detect HIV-2 infections, which are less common in the US. No test is perfect. Tests may be falsely positive or falsely negative or impossible to interpret. Positive tests are reportable to the health department in all 50 states that include their patients' names. This information is then reported to the CDC so that the epidemiology and infection spread rates can be monitored. The names sent to the state remain confidential and will not be reported to the employers, family members, or other such people. Some states allow anonymous testing in which the patient's name is not recorded. HIV antibody tests. HIV possesses many unique proteins on its surface and inside the virus itself. When someone is infected with HIV, their body produces substances designed to neutralize the virus. These substances are called the antibodies, and they are directed against the unique proteins of HIV. Unfortunately, these HIV antibodies do not eliminate the virus. However, their presence serves as a marker to show that someone is infected with HIV. HIV antibody tests are the most commonly used tests to determine if someone has HIV. Antibody testing is usually done on a blood sample, often using an enzyme-linked assay called ELISA or EIA. In this test, a person's serum is allowed to react with the virus proteins that have been produced in the laboratory. If the person has been infected with HIV, the antibodies in the serum will bind to the HIV proteins, and the extent of this binding can be measured. Negative EIA results are usually available in a day or so. Because there are possibilities of the tests going wrong, even though all tests could be positive, there's always a second test done on all initially positive tests. The second test is called the Western blot test. In this test, the HIV proteins are separated by size and electric charge, and the person's serum is layered on the test strip. If the test is positive, a series of bands are detected which indicate specific binding of the person's antibody to specific HIV virus proteins. This test is only done in combination with the initial screening test. HIV RNA is different than all human RNA, and tests have been developed to detect HIV RNA in a person's blood. This uses a type of test called polymerase chain reaction, also known as PCR. These tests are important for newborn screening of HIV-positive mothers since maternal antibody may cross the placenta and be present in the newborn. These tests may also be helpful in detecting HIV infection in the first 4 weeks following exposure, before antibodies have had time to develop. However, they are costly and are not routinely used to screen for infection. The HIV combination test detects antibodies directed against HIV-1 or HIV-2, as well as a protein called P24, which forms part of the core of the virus. This is important because it takes weeks for antibodies to form after the initial infection, even though the virus and the P24 protein is present in the blood. Thus, combination testing may allow for earlier detection of HIV infections. Preliminary studies suggest that diagnosis could be made on an average of 1 week earlier using the combination test compared to the antibody testing alone. The test uses a reaction known as chemiluminescence to detect antibodies in P24 protein. In other words, if either the antibody or the P24 protein is present, the test reaction emits light that registers on a detector. There is only one currently approved combination test, the Architect HIV AG/AB combo assay. If this test is positive, it is recommended to be repeated. Tests that remain positive are confirmed the Western blot as described above. How long does it take to get results back from an HIV test? Results from antibody tests that are sent to a laboratory usually take 1 to 3 days to return. If the test is positive, results may be delayed while the laboratory does a Western blot to be sure that HIV antibody is present, which is when they take the second test. Western blot tests take only 1 day to perform, but some laboratories may not run the test every day. Results from rapid tests done in the doctor's office or at other points of care are usually available in 15 to 20 minutes. If the rapid test is positive, it is still necessary to send blood to a laboratory for a Western blot to be sure the rapid test result is correct. Home tests are mailed to a laboratory and results return in 1 to 2 weeks. RNA testing results usually take a few days to a week, depending on the lab. As far as counseling goes with HIV testing, each state establishes requirements for HIV counseling. Most states have supported an opt-out testing program in which people are recommended to have HIV testing but may opt out if they choose. Such programs should include counseling about HIV, including prevention of infection, the meaning of the HIV test, and the need for appropriate follow-up. Opt-out programs have resulted in earlier diagnosis of many people with HIV. HIV testing may sometimes be done if a healthcare worker or first responder has significant exposure to the blood or body fluid from an identifiable person. In this situation, testing without consent is available in most states. All blood and plasma donors, some prisoners, and some military personnel are tested for HIV.